Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we are excited to be interviewing Dr. Jessica Schwartz, who is an award-winning orthopedic residency-trained doctor of physical therapy, certified strength and conditioning specialist, and the founder of the Concussion Corner Academy, which is an online education platform for clinicians seeking to improve clinical outcomes in concussion care. She is also the host of the Concussion Corner podcast and owner of Physical Therapy to Go PLLC, a concierge private practice based in New York City.
After sustaining a life-changing concussion from a motor vehicle collision in 2013 and living with persistent post-concussion symptoms, Dr. Schwartz spent a full year in intensive outpatient rehabilitation. This experience revealed critical gaps in concussion care and sparked her mission to educate clinicians across all disciplines in healthcare. She served as a national media spokesperson for the American Physical Therapy Association for 10 years and is passionate about putting the care back into health care for this often underserved patient population. Thank you so much for joining us here on the podcast today. We appreciate it.
Hey, David and Emily, thanks so much for having me.
All right, so let's get right into it. I think we have some general ideas, but how did you really get interested in becoming a physical therapist? Talk to us about your journey.
Sure. I actually was told I think you should be a PT by my mom's best friend at work. He was a physician, a pediatrician, and I just remember sitting on the kitchen floor as a kid, and I had just torn my ACL, and he was like, "Jess, this would be a perfect job for you. You're an athletic kid." I played 4 sports growing up, and literally pre-op, getting ready to wait for my ACL surgery, September 2000. And he was like, "Yeah, you should look into PT. I think it's a perfect profession for you." And he was exactly right. And thank goodness for that.
What 4 sports?
Well, tennis and basketball were my primary sports. And I played volleyball and actually boys baseball up until I was 16. So,
Now, which
That's
sport
awesome.
caused the ACL tear?
yes, the basketball was the ACL tear.
That's what
And
I figured.
yes, it definitely, it was a bit of a freak accident, but I just remember I had like 2 EMS providers and they were named Steve and Steve. And I was in Rhode Island as a kid from like a native New Yorker and really far away from home. But yeah, it was definitely a journey. So
So then to take it one step further, when you started your journey in physical therapy, given the orthopedic injury, were you thinking you wanted to do more like sports ortho? Where did you think you wanted to go with physical therapy to start?
yeah, at the end of the day, I think we're all there. Where if you're an athlete, you want to work with athletes in sports. And then, for me, I loved working with kids. I worked at the 92nd Street Y, and I worked a bunch of camps my whole life for like 20 years. So I was like, okay, I could work with kids. I could work, and I have to tell you, I do all the above, and I've crossed that ortho and neuro realm. Even though I did an orthopedic residency, I do a lot of neuro, working with concussion. But I have to say, I love my geriatric patients still to this day. And, there's a certain age you get and you got to, you're allowed to wear sequins and just say what you want as New Yorker. So it's been a fun journey to be able to treat the full 360 spectrum of ages and athletes and so on and so forth.
I got to agree. And we do have 3 New Yorkers on the podcast right now. So this could get a little bit off the cuff at moments.
I know.
I can't just I can't just wear sequins and say whatever I want now.
Pretty much. It's 100 degrees here in New York. So depending on when this gets published, but yeah, I've got my iced coffee at 6 o'clock at night. So some of the words will come out, I'm sure.
So now that we learned a little bit about when you figured out that you wanted to get into physical therapy, when did you decide to start Concussion Corner podcast? And also, when did you decide that you wanted to start Concussion Corner Academy?
So I think it's kind of a realm of kind of things fitting in together, kind of like Tetris or like Legos, or Lincoln Logs, if depending how old you are listening to the podcast. But what I experienced was that I was being recruited by Division I like associations when I was playing basketball here in New York City, and and that comes full 360 with a concussion component because I really wasn't rehabbed aggressively enough back in 2000 as a female athlete. So I knew I needed to get there. You know, I was playing camps at Rutgers and looking at Maryland, and University URI was my number one. I was in Rhode Island when I hurt myself, working a camp and playing in a tournament. There it is, a New York accent kind of comes out a little bit. And it was just like, okay, we can do better here, just because I knew that I just could have been rehabbed so much better. So that full circle 360 kind of reinventing myself. I was hit by a car after residency in New York City. So an unlicensed driver hit me from behind in my Prius, and I was working at a dream job Monday, Wednesday, Friday. And I was actually plugging in a new iPhone that I just picked up at Best Buy uptown. I was driving downtown home and just didn't see it coming. And I was at a red light and totally, sorry, the phone just went off. Sorry and sorry for that, and totally was surprised. So I didn't see it coming. No airbag or anything. I got pushed about 30 feet forward with, even though my foot was on the brake, so I pulled the e-brake, and I was just really dizzy. I was aggravated, but no airbags. I was, New York City ticked. So I got out of the car and buckled my seatbelt, got out of the car, and went to really give the guy the business. And I was just incredibly dizzy, which we know is a predisposing factor for prolonged symptom with concussion and MTBI. Just to qualify that MTBI and concussion are synonymous in 2025. And that concussion is a type of traumatic brain injury, just for folks that may not know on the podcast. So I ended up going to the ED, and then what I thought was just a concussion, in quotes, turned out to be 10 to 14 hours of rehab for 14 months, per week. So, and I still do live with persistent symptoms to this day.
I'm so sorry to hear that, but it also led you to this path that you may have never even been on with Concussion Corner, and you have an academy. So how does the academy aspect work with your courses and everything?
Yeah, so just to follow that story up full 360, thank you for that. It's essentially, it was, as I was doing the rehab for all of this, it was like I was ready to go door to door and just start knocking on doctors and healthcare professionals doors, really, to say like, hey, there's so much missing here with concussion. Just for example, 2015 was the first formal didactic year that neurology residencies, so physicians, had training in concussion. So keep in mind, my injury was in 2013, and I really had a comprehensive care team at NYU in their concussion center. So my rehab from 2013 to 2014, while it was excellent, there were still so many I don't knows. So, at the end of the day, I was like, how do we bring this information that's interdisciplinary, that's next day knowledge translation, and really with the world's leaders? So essentially what happened is I started the Concussion Corner podcast in 2018. I was asked as a physio to to be the host and the MC for the Lee Steinberg Brain Health Summit at the Super Bowl. So for those that don't know, Lee Steinberg is like the real Jerry Maguire. So he's like the biggest person in football, and he really takes care of brain health when talking about NFL and football players. Joe Montana was one of his former, athletes, and there was a big concussion, I don't want to say scandal, but a issue with him in the past. So I was super honored to do that. So I emceed that, and everyone's like, are you going to write a book? Are you going to tell your story? What's going on? And I was like, let's start a podcast. So lo and behold, we're in over 60 countries, and just super grateful to, have done that. We took a year hiatus, but we're coming back in July. So get your podcasts ready and resubscribe to us, because we're going video and doing all that. So podcast turned into Academy in 2021. And then we launched our first class in January of 2022. And essentially I cold called all of the faculty that I have that are top 1% in the world. And I said, I have an idea. Can you hang with me for 3 years? And they all said yes. And here we are today.
No, that's awesome. So talk to us a little bit about the challenges of starting Concussion Corner Academy. How did your journey look, and how, rigorous was it for those few years to really get this set up and such a name made for this company now?
Yeah, I mean, at the end of the day, it was really just being persistent of showing up to interdisciplinary conferences and having conversations online on social media, and not pushing the envelope too far, in either direction, but just making sure that we're advocating for interdisciplinary conversations and direct access as physical therapists, so that we're leading the team. 2017 was the first year that we called concussion a rehabilitative injury. So we just turned 100 in 2021. We were rehabilitation aides literally in a pandemic in 1921 during a world war. So really coming full circle, having direct access, calling the injury rehabilitative, really connecting to that we're treating severe traumatic brain injury in the hospitals as rehabilitative injuries. So we were literally doing that in the trenches in World War I. So in absence of evidence in medicine, we see that with concussion, MTBI, multiple sclerosis, pregnancy, a lot of women's health issues. We either tell the person that to rest and do nothing, which we actually do know does harm now with evidence, or we allude that it's all in their head and they're making it up. So that's kind of what we've seen with MTBI and concussion. So I want to make sure that we validate the patient's symptom profile by doing comprehensive targeted physical examinations, and that all can be rehabilitative and have an interdisciplinary model. So, working in a silo, autonomy does not mean working in a silo. So really making sure that we cross the aisle with having these conversations and helping to treat patients is really what we do. So it's been a blessing.
That's really fascinating.
Oh, go ahead, David.
Yeah, no, I was just going to say that's really fascinating. And actually, the very first conference that I went to professionally after passing my board exam was a concussion-focused conference where it was in New Jersey, and it was with Dr. Chris Nowitsky and also Dr. Susan Whitney. Both of them were talking there. And I went because concussions are always very interesting to learn about. And also, I'm a huge pro wrestling fan, so Chris Nowitsky being a former pro wrestler for the WWE, of course, I'm going to try to get on over there. So yeah, they're doing incredible things in general with concussions, and I love the awareness of concussions now.
Yeah, Chris is a good friend, and I knew him before he became Dr. Nowinski, so I'm happy that he crossed that threshold. It's an interesting story because he actually wasn't able to touch the brains at Boston University until he got his PhD. So I'm super stoked that he was able to do that and advocate more. Susan Whitney also just a tremendous vestibular human in our field, and just really pushes that rehabilitative, really the godmother of vestibular rehab.
Yeah, I think that I totally agree with you with both of those.
No, and I think you just gave some great advice, because my next question was actually going to be, what is one thing you feel as though could make the physical therapy profession better, especially within the world of concussions? But you kind of just touched upon that. Is there anything else you would want to mention?
Yeah, I mean, I think we touched on autonomy does not mean silo. So I think that's really important. I think when we were getting direct access, I think we stomped on a lot of people's toes, which were our brothers and sisters in OT and speech and so on and so forth. For me, increasing psychological safety and diversity and leadership is really important to me as an educator. So I want to make sure that we have that, kind of at forefront, especially at Concussion Corner Academy, where we're female led and we have a full diverse faculty from all over the world. But I think at the end of the day, it's really expanding direct access and advocacy as doctors of physical therapy in this country, at least, and really leading the path forward for all physical therapists internationally. And at the end of the day, that really goes hand in hand with prioritizing interprofessional education, because if we're going to have direct access and we are going to be first line of defense, we want to make sure that we can refer immediately and appropriately and do a good differential diagnosis. So I think that all kind of comes, 360, just with being good stewards and really practicing top of scope for the profession.
Yeah, so I kind of want to layer onto that a little bit more then. For students, let's say a new grad who's interested in maybe treating concussions, but they didn't feel like they got as much training throughout their curriculums and they don't feel as confident, what do you recommend the first steps for them are to further pursue their knowledge for concussion treatment, to make sure if they're having direct access patients that they're maintaining safety and the best knowledge set as possible?
That's a loaded question in a great way. There are a lot of free open access things that you can do that are safe zones. What I can say that I want to, and not a plug for myself, but The reason why we don't have a certification in concussion at the academy is very important for folks to understand, especially as new grads. But again, we've had folks 0 to 39 years out come through in our first couple years when we were in beta. So we're just going to be coming out of that actually in a week. So it's super exciting. But again, we have over 43 working definitions of concussion. So again, I know when folks are going to come out of school, they're going to come out really hungry and wanting to learn more and really become more autonomous and get that direct access depending where you are in the US. But what I can say is that there are some companies that do have certification in brain injury outside of the Brain Injury Association of America. And I just really don't agree with that pathway. I find if it's more of a marketing issue, and it's also a nefarious thing where we do find patients suffer because it might be like a weekend course, but then they have this certification in concussion. And I take a really humble approach. Someone who lives with persistent post-concussive symptoms, is a doctor of physical therapy that's residency trained. I want to make sure that folks understand that there's over 43 working definitions of concussion. One of them is evidence-based. That's it. So how are we certifying that, right? So we want to make sure that we validate the patient symptom profile. And the number one thing we can do for concussion patients is to say, well, you know what, I don't know, but let me take the time to find out. Because someone that's neurologically compromised and or neurocognitively compromised, we want to make sure that we can help them and that they don't hit a nefarious place in their treatment or care. Before someone gets to me, they see 6 to 8 providers before they come to me personally as a provider. So it's a very frustrating situation, which I'm sure you also see in the pelvic health realm, until they get to that right provider or even learn about that pelvic PT exists, it's important to connect to. So, there's a free open access. The Concussion Corner podcast is free open access. There's the International Consensus Statement that is kind of our gold standard, Concussion in Sport Group, CISG. And that's a free document that comes out every 4 years. And that's a really good place to start. And then just trying to, take in as much information as possible, but really seeing where that source is coming from.
Yeah, I absolutely love that you just touched upon it's okay to not know everything and say, I need a minute, let me look into this, let me discuss with my colleague. I think that's one of the best things within our profession is I feel like so many physical therapists, we're not afraid to say we don't know and look into it, which I think is something really important in all, especially specializations within our field.
Yeah, and it's the number one thing that we push at Concussion Corner is, I don't know, but let me take the time to find out is so important because what you say to a patient, you may have, up to 33% of patients with TBI have erectile dysfunction that are male. So, a male signed at birth. So just keeping in mind that you may have a 15-year-old athlete come into you and they may actually have some neuroendocrine issues going on, and they may actually have some erectile dysfunction. How are you going to get down that pathway and have that difficult conversation? So really getting uncomfortable, getting comfortable asking the uncomfortable questions, because I guarantee that the patient in front of you is going to have is much more uncomfortable. So we just want to make sure that we're really just providing good stewards in the world to make sure that they're doing good work.
In providing as good of a product that you're providing and everything, and starting up your own business, what was the biggest difficulty that you faced personally when starting up a business? What was the most difficult thing?
I think access to good information. I bootstrapped everything by myself. I'm not independently wealthy whatsoever. So I built everything. I built all my CRMs. I learned how to code. I learned how to use Notion. I learned how to automate with Zapier for certain things. I didn't even know how to take a credit card payment when we first started because my practice is cash based. So cash check, Zelle. But really having access to people, and that started with years and years of cultivating relationships online through social media, interprofessionally, and within the profession. Karen Litzy was a huge resource for me. She helped me start my podcast. She gave me some guidance. For example, in New York State, you have to have a PLLC to be a provider, and a lot of people don't know that. So the fact that I started up my practice properly from day one, as opposed to have to go back and 360, fix something. So really just, I think access to good information, I would say just do it, but you have to make sure that you really have all those I's dotted and T's crossed. But there's so much that you can do. And, you may be doing all the things. You're going to do your scheduling, you're going to do your emails, but make systems, make standardizations, learn as you go, and really be kind to yourself. I think is important because it's really failing forward. You have to learn, to undo, So anyway, so just keep going and have support.
Yeah, I mean
Yes, so
that's yeah, go for it, Emily.
I was going to say, while you're on the topic of giving such great advice, you gave it a little bit from a business standpoint and, within your clinical experience, but what is one piece of advice you would give to physical therapy students who are still undergoing their education?
Stay curious. I mean, it's really that simple. Stay curious and get uncomfortable with saying hello to everybody. It's a really small network of humans. So literally our world's president was just in New York City and then we had lunch and it was that simple. And she's in Ireland. So there should be no reason that that would happen, right? But those happen based off of years of cultivating relationships through social media, through conferences, through little meet cutes throughout the years. And just really, you know, just being kind to others. It's such a small world that we're in as PT, and it's such a honor to be in the profession, quite frankly. Just to be able to serve people, but remembering that burnout in healthcare is real. Everyone's going through something, whether it be a brain injury or, loss of a child or a divorce, whatever's going on in someone's life, so just really making sure to, lean in with a smile and be curious and just reach out that, you'd be surprised with one email that most people will respond. And if they don't respond, they might be busy. So send that email again and don't take it personally.
Yeah, I think that's great advice. And now it is time for a fun surprise question. You have no clue what this question is. And I actually have two. So the first one is going to be, you're based from New York City. What are your most favorite things to do in New York City?
Ooh, is it favorite things that I like to do or favorite things that I take people to do that are tourists?
Oh, let's go with you. Let's personalize this.
Okay, let me think here. So I've got two elderly dogs that seem young. So if there's a dog park involved, that's always there. And I'm a cyclist, so I love to ride my bike. So I'll ride around the tip of the island and up and down all the way to the GW Bridge. I ride up in Westchester on the North County Trail with my partner. And she was going to buy like a Costco bike back in the day. And I got her a real bike, which was great. So she's a graphic designer. So I said, listen, you can't do your 3D graphics on a Google Chromebook. So I was like, we can't get that Costco bike, but we're still together. So that's good. And I love the farmers market. So Union Square Farmers Market on a Saturday morning is one of my most favorite things. And just eating, there's so many good restaurants in New York City. So you'll usually find me at one at lunch.
Well, that leads me to the second one. Where's the best place to go get a slice of pizza?
Ooh, okay. So it's a 2 or 3 part answer. So I have to say, I think for a regular slice, so a triangle slice, that's L'Industrie, and it does live up to the hype. I go to the one on Christopher Street. I'm a Village kid, so Christopher Street, L'Industrie. Mama's too is good, but L'Industrie, that burrata slice is a 10 out of 10 New York City slice, I have to say. And then for a square slice, I really do it. No one ever talks about it, but there's a place called Garlic Pizza on 2nd Ave around 34th Street. And it's not too far from NYU, where I did my residency. And I have to say, I think they have the best square slice in New York. So.
All right. Me and Emily have some traveling to do because right now the only thing that comes to mind is Joe's Pizza. But I feel like that's kind of a go-to at times. So I think that we just have to do a Final Frontier pizza review tour of me and Emily just going pizza slice by pizza slice. As if nobody else on social media has ever done this before.
I used to love this spinach artichoke pizza.
Yeah, artichoke is good. Artichoke pizza is great. Gnocco is great for just an individual, like Northern Italian. So there's like so many different types of pizza. So I get opinions from here to Brooklyn and Staten Island. So, but I kept it local to Manhattan.
Yeah. Now Connecticut wants to say that they got the best pizza. I don't know what that's about.
I know Pepe's. I respect Pepe's pizza. I'll hang with Pepe's every once in a while.
Got to respect the game.
Absolutely. Okay, now I'm hungry. I wrote those down too because my sister is obsessed with burrata and pizza, so I can't wait to tell her about her this burrata slice because she works in the city. I'm surprised she doesn't know about this.
Yeah, well,
I wrote it down.
the secret for your sister and the secret for your listeners and everyone's welcome in advance is that the line is usually out the door at noon when they open. So just order a pie online and you go pick it up. And it's
Oh,
that simple. So
perfect.
just order a pie and then you keep it moving. But if you
I'm
can't,
actually
like,
taking notes.
yeah, yeah, no, it's fantastic. And yeah, PTs love food. So cyclists love
Yeah.
food and coffee. PTs love food. So it's how you can also make friends that way too, invite them out to a slice. But if you guys
Yep.
come on in, we'll have a bite.
Of
Oh, I
course,
love
the
that. I
three of us
know.
will meet up for that slice.
I was gonna say my favorite thing to do in the city, I love to run. So I do a lot of race. I do a lot of the New York Roadrunner races in the city. But my
Awesome.
favorite part is not just the race, it's eating after the race in the city. That's the better part.
It's nice because I ride my bike in Central Park sometimes.
Yeah.
I'll go up there. So it's you kind of get to know like each exit hole of like what's kind of food based around there that allows bicycles. So you can go east
Where
side,
should I
west
get
side.
my coffee? Where should I get my pizza? Love it.
Exactly.
That's awesome.
All
I
right,
think.
so go ahead, David. Now
No, I was
David's
going to
just
say
on the
for me,
topic of food.
I think for me it's museums. I think that's what I like to do usually in New York City. I love history of New York City. I'm fascinated by it, and so I think the more of the historic route,
Which is your favorite
that stuff.
museum?
So I think that right now it really depends. I feel like I always change, and I feel like there's so
Yeah.
many museums that I still don't know. But most recently, the one that I really loved was the Museum of Modern Art, and seeing Starry Night over there was just incredible. I know.
Yeah.
So I'm looking forward to more museums to go to.
Well, definitely try the Whitney next. You can go for free Friday nights, and I think they have like certain nights where if you're under 30 or something like that, you can get in for free. But Friday nights are free at the Whitney, and then you can go take a walk around my favorite art installation, which a park called the Little Island, right off of 14th Street on the water, which is right across from the Whitney.
Oh, I
So
love the little island.
yeah, so you can go there and it's accessible for patients too. So if you guys ever have patients, you can refer them over there because it's totally accessible. And then you get to the top and then you can see the entire city 360 on a clear night. You can see the Statue of Liberty too. So it's a nice little way to finish off a museum.
That's
Wow, we are
awesome.
learning some great extra New York City tricks right now. I love this.
Yeah. So yeah, happy to. It's so funny because we've served students in 39 states and 6 countries at Concussion Corner in our first 2 years. And it's so interesting because we've only had 4 New Yorkers and 3 of them came together from a hospital. So 2 separate batches of New Yorkers. But everyone else of our 200 folks that have come through have been from other states and countries. So this is always fun. So
Yeah. So speaking of Concussion Corner, how can our listeners get in touch with you, find you on social media, learn more about these resources?
sure. So I'm on all the social medias as DPT to go, Doctor of Physical Therapy, the number 2 go. My practice is called Physical Therapy to go. So that worked out. And then in terms of reaching out to the academy, we also have Concussion Corner throughout the social medias as well, as my little cousin says. So we're on Instagram, TikTok, Facebook, and Blue Sky now, and Twitter. I'll never call it X, just Twitter.
I'm so happy you just
Yeah.
called it Twitter because I always have to do our outro by saying X and I accidentally say Twitter every time.
Yep, it'll be Shea Stadium forever, and it's Twitter for me. So I'm sticking with what I know, and then yeah, so from there, and then concussioncorner.org. So podcast is on all the places. We haven't really posted in over a year there, but we've had we still get a couple hundred downloads a week there, and everything is still pretty accurate, which is great in terms of the concussion world. And then we also have discounts for students, residents, and fellows. So that's always up there for folks to come through. So always happy to do that. And what's different about us is we're on demand, but we have one-on-one coaching twice per week with myself. And then you can actually meet our faculty, which is the only program in the world that does this, in our fall cohort. So from September to December, we're just starting rolling admissions. So you can start anytime now. We have 2 12-week programs. And we literally cover everything from sports neurology, pediatrics to OT, speech. It's all there. We have 3 weeks of neurooptometry. We have the world's leader in the cervical spine in Australia doing our cervical spine section. It's all there. And then 2 12-week programs, about 2 to 3 hours per week. It's all bike fitness, so learn on your own. Come in for office hours with me, and then actually get to meet all those awesome faculty in the fall. So it's really a unique program, and I'm just so blessed that we were able to build it. And it took a lot of sweat equity, about 40 hours per week to build this thing, and we have 24 weeks of programming. So stoked to get it out there.
That's great.
That's awesome. Well, thank you very much for joining us. We really do appreciate you coming out to the podcast.
Thank you so much for having me on, guys, and let's actually do a slice next time.
Yep.
Yes. Now that you heard our interview, here is a quote from Sue Bird. If you're always comfortable, you're not growing. Moving forward means being okay with being uncomfortable. So, all of you listeners out there, go get uncomfortable. Continue to grow. Go get your dreams. And guess what? After you achieve one of them, go pursue that next one. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, X, and TikTok.
Till next time, have a great day and a powerful tomorrow.